Thanks to everyone for joining today. This is the very first inaugural OII webinar, and I'm sure it will be the first of many successful virtual events that we'll do together. It's a great way for all of us to come together as a community and continue to exchange on some of the work that we've all been doing during the coronavirus pandemic. So today let me try to share my screen. Okay. Can everybody see this fine? Okay, I have the chat. Okay, wonderful. So like I said, I think most of you know me already, but if you don't, my name is Nahema. I'm a doctoral candidate here at the Oxford Internet Institute, and I'm also a researcher for Comprop, the Computational Propaganda Project. And today I'm going to talk you through essentially one of the studies that we conducted in the past couple of weeks. This is the second in a series of data memos that we're releasing about COVID-19 and how people obtain news and information about the pandemic broadly. We published our first data memo last week, which was about the way in which different state-backed media outlets were reporting essentially on different facets of the pandemic. And today, I'm going to talk you through our study of YouTube coronavirus news and information. This is very much, a first in many ways. It is the first study of YouTube that our research group has done. And I believe, or at least up until Friday, I think it was also the first study of YouTube and COVID that I'd come across. This is very much an exploratory study, but I hope that you'll find some of these takeaways informative. So just to talk about briefly some of the motivations for this. So as many of you know, and it will come at no surprise to anybody, YouTube has emerged in the last decade as a major source of information, particularly about health, science, and technology. It has 2 billion active monthly users, and people tend to search a lot on YouTube, and they use it as a search engine, and it is in fact the second largest search engine after Google by search volume. We also know that it's a major source of information for young people primarily, people that tend to engage more with video-based content than textual content in the forms of news articles. So we were interested in finding out essentially what average users who would search for particular terms on YouTube that are related to the coronavirus would come across, and what broadly the quality and types of content that people would see are. And so this is sort of underwritten by 2 different facts, which are that, as I mentioned, people tend to use YouTube a lot as a search engine. So by entering search terms in the search bar and then clicking on the results, and people rarely scroll in fact past the first results page. So if you go on YouTube and type a query, you'll have about 20 videos which are returned on the first page before you have to continue scrolling down. And we also know that actually most of the time that people spend on YouTube is due to recommendations, which makes sense, in light of YouTube's business model, which is geared towards, retaining people's attention and making sure that they spend as much time as possible on the platform. So there's various ways in which YouTube will suggest or try to nudge a user to continue watching something, either with the up next feature, some of the recommendations on the actual landing page, and related videos in the sidebar. So what we decided to do for this study was to essentially look for popular search terms, things that people had been looking up. And we did so using Google Trends. I'm going to explain this in greater detail in just a second. And we collected in total about 8,900, almost 9,000 YouTube videos on March 20th. And out of these, we only analyzed 320, which corresponded to the top 20 video results and the top 60 most frequently related videos per search term. Again, I'm going to explain this in more detail in just a second. Hubert and I essentially classified the channels that were disseminating this content, and we also did the content classification of the videos themselves, as well as a sort of high-level thematic analysis. So in terms of the search terms themselves, I don't know whether you can see here in detail, but the screenshot from Google Trends here shows and compares the popularity of the term coronavirus and COVID-19 since January 1st. So you can clearly see, and this was the main motivation behind my choice, that coronavirus was a way more popular search term than COVID-19, particularly at the time of data collection. So we decided to proceed with that one. And we simply search for related terms that were associated with that one. So you can see the top 10 on the day that we did this search, which was March 10th. And I've highlighted in yellows the one that overlapped with, essentially for comparison, we also looked at the search suggestions on YouTube using a Chrome browser in incognito mode. So that, there's some degree of localization in that. This is for YouTube, Great Britain, but there's not all the personalization that would come with logging into YouTube from my own personal Gmail account, for example. And we decided to settle on the 4 terms that overlap between both approaches, which were coronavirus China, coronavirus UK, coronavirus conspiracy, and coronavirus symptoms, as they clearly represented terms that were popular in searches, and they also cover quite a wide range of topics. It was quite interesting for us to look at what these search results would yield. And so to explain in a little bit more detail what I mean by top search results and top related videos, you can see here just a screenshot of YouTube. So if you enter the search term here in the search bar, what we mean by top search results are the first 20 videos that would normally appear here. And so we queried what's called YouTube Data Tool, which is an interface that was set up by a professor at the University of Amsterdam that just it queries essentially the YouTube API and just gives us back results in a CSV file, which is very handy. And so we did that for all 4 searches, and we got an initial seed list of top video results for these 4 search terms. And we then used this seed list to further query the YouTube API in order to obtain a list of all of the videos that are related to the original seed list. So if you imagine this video here of Boris Johnson as a seed video, for each seed video, we would then get a corresponding list of all the related videos that are showed in the sidebar. And so we did this for the 4 search terms. So we essentially crawled the network at a depth of 1. We created little network graphs and basic network statistics to figure out which were the related videos that were the most frequently linked to. And we decided to settle on the top 20 results and the top 60, most frequently related videos for our analysis. Okay, now, so once we had done that, and we had our final sample of 320 videos, we proceeded to classify the different types of channels that were disseminating that content. So I'm going to try to go quickly over this because it's pretty self-explanatory. So professional news channels were essentially the channels of established media organizations, broadcasters, digital and print media outlets. And in contrast, independent content creators, again, pretty intuitive, I think, for most people who use YouTube, channels of independent vloggers, maybe media commentators, and we also included in this category independent health professionals and educators. So any channels that did not fall into the professional news channel category or any of the other ones were considered independent content creators. And I will provide more specific examples of that in a second. Professional health corresponded to either domestic or intergovernmental public health agencies, as well as hospitals and professional health websites. So you can think of, the YouTube channel of the WHO, for example, NHS England, or professional health sites like WebMD. Finally, we had a category for state-backed media, which is simply media organizations that are funded by the state or editorially controlled by the government. And finally, we had government channels. So you can think of the official channels, let's say, of the US White House or the United Nations. So following this high-level classification of channels, we then proceeded to look at the actual content of the videos in our sample. So again, I will be giving you specific examples of that, but just as a quick overview. We took a sort of heuristic and grounded approach to the coding, since it was the first time, that we analyzed YouTube videos. And so following, prior work in this area where people had and researchers attempted to determine what the content that was conveyed in YouTube videos were, we took a heuristic approach that was based on a mix of assessing the factuality of the video in itself, as well as the type of evidence that was marshaled. So whether people were relying on testimonial evidence, whether they were providing their own personal opinions, and also the degree of politicization, essentially, of the content. So we classified videos that were as factual and neutrals when they were factual and high quality reporting on the coronavirus pandemic. This would include everything from factoids to real-time case trackers and news reports from professional news agencies and public health agencies. Let me see if I can show you an example. Oh, I'll probably show you that in a second. Personal and investigative, there was videos that discussed the pandemic from a personal, testimonial, or investigative point of view. So by that, we meant videos of patients, for example, describing their symptoms, testimonies or recommendations from independent health practitioners. And there were also debunking efforts from bloggers. And we also included in that category undercover investigations and talk shows. So again, I'll show you an example of that in a second. Political were videos in which the pandemic was discussed. So particularly its provenance, its spread, and government responses and how efficacious those were. All of that was discussed from a political perspective. So we included in that political comedy shows, political debates, podcasts that were of a political nature, and what we've called politically motivated fact checks. And then finally, junk and conspiratorial were videos in which the information that was relayed essentially was either demonstrably false or constituted of conspiracy theories about the origin, transmission, and treatment of the coronavirus. Anything that could be classified as trutherism, so doubting the actual existence or seriousness of the pandemic, and xenophobic content and denial of mainstream scientific positions. And we always assess that against WHO public advisory information. And finally, we had videos that were not related to COVID-19 or that were not in English, which we decided not to code. So to give you examples of all of these different content codes, here typically you have a video that could have been classified by us as factual and neutral. The screenshots I'm going to show you are not all part of the data set, but the ones at the end are. This is just the sort of ideal type to illustrate the different categories. So here you can see a news report from Sky News, very factual, just stating the amount of death, essentially at a particular point of time in the UK. This is one example of what we would have classified as personal and investigative. So here you have a popular morning talk show where essentially a doctor is being interviewed, followed by a number of patients, people who have recovered from the coronavirus and are sharing their stories and experiences with the public. Another example of, excuse me, a video that would have been categorized as investigative. Here typically is a journalist, going undercover at wet markets in China. If you actually watch the entire video, the Chinese government response is not being discussed from a political perspective, but you have a clear departure from just, factual, journalistically neutral report to something that is a little bit more editorialized and presented from the perspective of the reporter. And then one last example of personal investigative is videos such as this one from quite a popular independent content creator who is seemingly a doctor. He calls himself Dr. John Campbell, and he is imparting advice and recommendations as to how to protect yourself and your family from the coronavirus, with listicles and different pieces of hygiene advice. And finally, this is an example of what we would have classified as political or politicized content. This is an excerpt, from the late night show with Seth Meyer, which is a late night format in which the host is discussing essentially the US response to the virus and criticizing Donald Trump for his lack of factual accuracy in some of his press briefings. And then lastly, this is a video which some of you might have heard of or even come across. This is actually still on YouTube, but this is a video from a channel called London Real, which is an interview of David Icke, who's a quite famous British conspiracy theorist, in which he's discussing the pandemic and sort of alluding to various shady conspiracy theories about the origin of the virus and that it might have escaped from the lab, etc. So this is typically the kind of content we would have coded as junk and conspiratorial. So now, moving on to the main findings. So I apologize for the tables here on the side are a little bit small, but everything that I've just talked about, as well as the tables and the sources for everything I've said, are in the memo and then the online supplement, which you can find on the Comprop website. So main findings, we only found an extremely small percentage, you can see here it's 0.3% of the channels to be professional health agencies. In fact, only one channel out of all the ones we coded fell under professional health. It was the channel of a hospital, and the video itself was actually not in English. So we did not find, anything that was being shared by the WHO, NHS England, or any of the sort of usual suspects of some of the channels that you might have expected to be, sharing this type of information. However, that does not mean that there were not a lot of factual videos. They were, and in fact, it was by far the biggest category of content that we came across. You can see here for the UK, for example, 80% of the top 20 video results were highly, factual reporting. But a lot of that factual content came from professional news organizations. If you look, at state-backed media, we found a couple of channels from outlets such as CGTN, GB Times, and Russia Today. And these, were, again, it was a relatively small percentage of all the channels we coded, about 2%. But they comprise about 6% of the top and most related videos for queries that were linked to coronavirus conspiracy. And the junk and factually inaccurate content, again, was a very, very small fraction of videos in our sample. Altogether, if you take both the top recommended and the top video results, it was about 2% of everything we found. But in contrast, here you can see searches and videos that were linked to coronavirus China tended to return more political or politicized content. I'll get into more detail about this towards the end of the presentation by giving you specific examples. And a lot of the video results associated with the symptoms search query, again, perhaps unsurprisingly, tended to be more personal. So there was a lot of testimonial evidence, people discussing their own symptoms or providing, health advice, again, discretionary health advice to viewers from a personal perspective. Here you can see the distribution of the different content codes per channel type. So again, as I mentioned before, most of the factual, high quality reporting came from professional news channel as well as independent content creators. Political content is almost evenly split between professional news channels and ICCs. And similarly, personal and investigative, you had Sayback Media and independent content creators sharing this, and the junk and conspiratorial came from both independent content creators and professional news channels. I'll explain why in a second. Again, here you can note the omission of the professional health category because, as I mentioned, the only channel that we coded as such linked to a video which was not in English. So I've omitted it from this figure. We also had a brief look at how the public was engaging with different types of videos. I do mention this in the memo, view counts and comment counts are not a perfect metric to gauge public engagement, particularly because a lot of news channels tend to stop comments actually on some of their, particularly on live streams. So you do not always have, an accurate comment count or one that is reflective actually of how much people might be wanting to engage with it when it comes to factual and neutral. So here I would say that the average number of comments is probably slightly underestimated for factual and neutral content because it comprised so many news reports. But overall, you can see that politicized health info tended to receive on average more comments per videos, but it is the junk and the conspiratorial content that has a higher comment to view ratio. So these videos were not actually seen by a lot of people, but those who do see them, tend to engage with them a lot through comments. So by, either calling out somebody in the video or opining about, how the deep state is behind the spread of disease or things of the like. So now I'm just going to give you some specific examples of some of the content that we found. I did toy with the idea of showing you different videos, but I thought that would be a little bit too long. So I'm just going to quickly go through some of the main themes and some of the key narratives essentially that transpired from our content and thematic analysis. So once again, factual and neutral content made up the great majority of what we saw online. A lot of it were news reports, live case count trackers, particularly focusing at the time, because I guess it was the height of the expansion of the virus in the heart of Europe. So a lot of news report focusing on Spain, Italy, France, doing daily death tolls, etc. A lot of videos that spoke to the impact of the coronavirus on the stock market and its potential impact on the economy. Again, from a neutral perspective, there was no political discussion of economic policy. A couple of explainers, a bit like the one you can see here from The Guardian. What is the coronavirus? What are the symptoms? And news reports that were sharing WHO guidance as well as advice from government officials, or sharing some press conferences in which they were explaining to people what the measures taken in different places were. Now, for personal and investigative videos, again, as I've explained before, a lot of testimonies from patients who either had COVID-19 and had recovered from it, or those who were still in hospital, as well as ICU doctors. So you can see here, for example, a video from Channel 4 News, coronavirus survivor reveals what it's like, as well as these sort of morning talk show formats, again, lots of those, how to protect yourself from coronavirus, people, bringing on guests that might give recommendations on social distancing, on gatherings and hygiene measures, as well as more lighthearted discussions of, for example, the risk to young people. There was a lot of mention that week of, US students going on spring break and whether they would be able to continue their holidays as planned and the like. Now for political content, so a lot of the content revolved around discussions of the adequacy of various government responses. I would say mostly it tended to revolve around the US, the UK, and China, with the main topics addressed being, for example, the lack of ventilators, or the lack of appropriate testing in different countries. There were a lot of videos, as I mentioned before, politicized, video results for coronavirus China tended to be the ones that returned the most politicized videos. So a lot of them discussed the Chinese government's media censorship, for example, and we also saw a lot of examples of politically motivated debunks. So I don't know if you can see here, but there were a number of videos that would claim, for example, to debunk the left's lies about coronavirus. Or here, as you can see from an independent content creator, Sean Hannity, who is an American TV host, right-wing TV host, a debunk of his lies, essentially, on Fox News. And then finally, we had a number of videos that tended to sensationalize the virus origin. So again, without sharing outrightly, anything that was factually inaccurate, but simply, doing undercover investigations, let's say, of the wildlife trade, or going to wet markets. So I've included a video here that you can see. It's again an independent content creator, and the title of the video reads China coronavirus COVID-19 birthplace, trip to infected zone. So a lot of these types of sensationalized videos that veer on the exoticization, essentially, of China. And then lastly, again, I want to emphasize that junk and conspiratorial content made up an extremely small percentage of everything we coded. But just to give you, a quick overview of what these videos were actually about, there were one or two videos that implied that there had been an intentional cover-up or an underreporting of cases from the Chinese Communist Party. In fact, there was more than implication. I would say that it was a indictment of the Chinese Communist Party for having covered up cases. One of them was based on this Epoch Times investigation, supposedly. And I just wanted to point out that Epoch Times is a news outlet that has been frequently accused of publishing misleading and unsubstantiated claims, including various articles that promoted conspiracy theories about 5G and human health. In February 2020, so a couple of months ago, they shared articles that suggested that COVID-19 had been genetically engineered. So one of the videos that we found essentially was based on a supposed investigation of Epoch Times, and as I said, was making unsubstantiated claims. Secondly, there were quite a few videos that relayed, or sort of amplified the claim that the virus was called a Chinese virus. And again, we decided to code that as junk because it was directly going against WHO guidance, which has advice against using this term in order to avoid discrimination and stigmatization. So you had a lot of videos that were, emphasizing essentially the fact that this comes from China, and were therefore implying that using, colorful language about purity, that Asian people of Asian descent should not be let in, et cetera, in different countries. And finally, the last two, because I'm conscious that coming up to half an hour, videos that showed leaked footage from Wuhan. I've included a screenshot of that video here. All of the footage from that video came from a Twitter account which had been banned for breaching essentially Twitter's rules in terms of services, sharing essentially content that was unverified, and again purported to show police violence or people dropping dead on the street from COVID-19. And then finally, there were a couple of videos that bordered on trutherism, so that were extremely downplaying the lethality of COVID-19, or were comparing it to the flu and saying that the flu was essentially worse and that people should not care about COVID-19. Okay, so that brings me to the limitations. Obviously, there are a lot of limitations in this study that I think comes with, one, in its exploratory nature, and secondly, from some of the inherent limitations that are associated with researching YouTube. So I think it's important to remind everybody that this was very much a point-in-time snapshot. So, we collected this data on March 20th, 2020. There are so many YouTube videos that are being uploaded every single day, and there's definitely a trade-off between, the precision or richness of the content coding that can be done versus the scale at which, the scale essentially of what we could have analyzed. There are also other aspects of the videos, such as the tags or even the headlines or the comments themselves, that we did not include in the analysis this time around, because we were focusing mostly on the average user experience again, and what people would come across if they search, and whether junk or conspiratorial or factually inaccurate content was very prominent in these top results. So relatedly, it doesn't account for personalization and localization of results, which are sort of inherent to YouTube's algorithm and the way that it works. I should also note that at the beginning of the month of March, Google and YouTube essentially changed its policies about whether they would allow for the monetization of COVID-19 related YouTube content. So they initially decided to demonetize it because it fell under their sensitive events policy, and then decided less than a week later to remonetize it. And so that would have definitely, that could have definitely influenced the results from organic search. And then, as I mentioned before, we worked with the YouTube API. We also decided to use most of the default parameters that are provided by the YouTube API. So just to show you, once again, the top results. Right, so if you do a query, if you enter a query in the search bar here, by default, YouTube will return videos in what it calls, in order of relevance. So again, because YouTube's algorithm is proprietary, we have, limited understanding of how, that relevance is determined, essentially. And so to the extent that this metric is black box, or the algorithm is black box, it's difficult for us to fully understand the representativeness essentially of the sample at hand. But nonetheless, I think that it was definitely for us an interesting first exercise, and I guess a sort of reassuring one that it's not like misinformation is not present on YouTube. In fact, it very much is, and you know, a number of videos that we coded, even though there were few as drunken conspiratorial, are still on YouTube to this day. However, I think that a number of people who would want to engage with that content would perhaps search for that content more specifically, and if you search for these keywords in a sort of naive way, you're unlikely to come across this more misleading or junky material, as YouTube has been working really hard to bury it essentially in searches. So with that, I'm going to stop here, and I'm happy to take any questions. I think there are quite a few on the side. Okay. So I guess I'm just going to read some of the questions that were submitted here. I had one from Britt who asked, did you analyze the content of the comments given to the videos? No, so as I mentioned at the end of the presentation, we did not analyze the content of the comments. I think that would have been an interesting thing to do. We were sort of pressed with time, and again, it's a small data memo, not a big academic paper, and therefore we did not go down this route. But I think it would be very interesting to even do something like basic sentiment analysis on some of the comments, or even dictionary-based approach to see what kind of words people might be employing when they're commenting on different types of videos. Okay, then Julia asked, can you tell us more about what demonetization means and how it might have affected the top search results? Sure. So demonetization, so the way that YouTube works essentially is, I don't know if most of you are familiar with this, but content creators obviously upload video content to their channels. They have subscribers, and they make money essentially out of the fact that people subscribe to their channels and watch their content. So when YouTube announced that it was demonetizing coronavirus-related content, what they meant is that a content creator could not make money from a video that explicitly mentioned or referred to the coronavirus. And so that would have affected, I think, what we saw in these search results, because it might have disincentivized some of the content creators from publishing videos essentially that mentioned coronavirus in it. It's possible that within videos people refer to it, but they would not mention it necessarily in the title of a video, or they would not include it in the tags associated with it, and so it would not have been returned through our search. Okay. Does anyone else have any questions or comments? Nope. Oops. Okay. So Chico is saying that he sent a question and perhaps it didn't make it to me. I did not get it. So if you don't mind reposting, it would be great. Okay, so the question is, was this distribution of viewership any different from the expected? Was there a prior expectation? And did these results reveal anything surprising relative to that prior? We did not have, any expectations of viewership. I guess from a personal, point of view, I would have thought that, news reports get the highest number of views, just because, as I mentioned before, a lot of people also use YouTube, in certain demographics as TV channels. So as a portal to news, and will often watch news reports. So I guess it was surprising to find that they were actually quite similar sort of viewership numbers, except for junk and conspiratorial content. But no, we did not have specific prior expectations about that. Mark asked, is there an opportunity for governments and public health agencies to make greater use of YouTube to share health advice and information? Thank you, that's a great question. Absolutely, I mean, I think what's interesting about this is that, you know, it shows that despite perhaps YouTube's best efforts, and indeed, you know, efforts from even the WHO or other public health agencies to make sure that they were very prominently displayed, you know, in various platforms, whether that be Google or Facebook, they themselves, you know, did not either you know, create content that was sufficiently appealing to people to go and directly engage with it, or it was not, you know, favored by YouTube's algorithm to such an extent that that would be, you know, showing up essentially high up in the results. So I think that was definitely by far the most surprising finding for us. Like I said, there's a lot of factual content, but that content primarily came in the form of, you know, news reports that shared some of this factual information or this, you know, public health guidance, but not from the people that you would expect. Okay, another question here that says, I feel like some researchers says there's a lot of YouTube junk and this report finds nobody sees it. Should we be worried or not worried? And what should we expect YouTube to do? Or is it already doing it? Okay, I feel like this is slightly outside of my bandwidth, but I'll try to answer this as best as I can. Again, I think there's different stories to be told, and you know, the data or the findings that we got from this memo are not sufficient enough for me to like give a full answer to this. But either this tells a story about you know, people's search habits essentially, and the fact is that there is a lot of problematic information on YouTube. There is a lot of junk. There is a lot of, you know, misleading or factually inaccurate or sensationalist content, and people can definitely find it if they wish to. But we also know that YouTube is taking active steps to prevent people from falling into these, you know, holes essentially. And so there's a combination of different things. One is that, you know, there's personalization in the algorithm, which means that depending on, you know, content that somebody would have engaged with in the past, they're more likely to be shown, you know, in the sidebar videos that, you know, reflect these prior search habits. So if someone is more inclined or has repeatedly, as I did, in fact, you know, even just to capture the screenshots, I had to go back and look at some of these conspiracy videos and search for them with my own Google account. And, you know, I ended up getting tons of recommendations for more dubious content. So, you know, that's one of the mechanisms, although everyone who's been researching YouTube, I think would say that there's, you know, there's very rich debate currently about, you know, the radicalizing potential of the algorithm itself, and whether it's the algorithm that does anything, or whether it's, you know, the fact that the monetary incentives of different content creators and the ways in which they, you know, make sure to pass some viewers from one channel to another, and that people become extremely loyal to certain content creators that, you know, might lead certain people to come across more junk than the average user. But all of these are, like I said, more informed by my understanding, essentially, of YouTube than anything that the data from this memo leads me to conclude. Okay, a couple of questions coming. I think I'll take the last two, and then we're coming up to the hour. But Related to Chico's question, how easy was it to classify each video to one another category, and were the various video categories defined a prior or post hoc? Thanks. So was it defined prior or post hoc? Like I said, we took a grounded approach. So we actually started with a sample of 20 videos that we both watched, and we devised the coding categories and the content categories on that basis. So what are we actually seeing? Initially, we came up with a sort of traffic light system, which was reflected a little bit in the slides, going from sort of green to red. And then after this initial trial round, let's put it this way, we test coded 20 videos using the scheme. And of course, there were videos that fell, in between these categories. And so on that basis, we further refine essentially the coding scheme to make sure that we captured, everything that was in our sample. That's why, for example, I think the personal and investigative category was perhaps the one that was most tricky for us, because there was quite a lot of content, as I mentioned, that clearly departed from, a sort of factual rendering of, how many cases are currently there are currently in the UK, or of Boris Johnson talking about the measures that are going to be put in place, but that were not quite political discussions, and they were definitely not factually inaccurate. And these were videos that, like I said, built mostly on testimonial evidence. And so we had to sort of encompass, all of the content that fell under that. And so we refined that through 2 rounds of coding. Okay. From Christian, how did you deal with intercoder reliability, and what are the ways that you ensure that your high-level coding is fairly robust? Thank you for this. So I think I've just explained this a little bit, but as I said, we took 2 samples. We did a first round of coding, which was geared towards refining our categories, and then we did a second round of coding, which was to determine our intercoder reliability. So for people who don't know, although I would think that everybody knows, for qualitative coding, essentially you have to ensure that there's robustness essentially to the way that you are classifying the content. And so Hubert and I went ahead and coded these videos separately without consulting each other. And then we determined not only the degree of agreement, but also one metric, which is consensually accepted in social science for intercoder reliability, called CRIP-endorsed alpha. And we got a CRIP-endorsed alpha of 0.803, I think, which indicates strong, essentially, intercoder reliability and robustness in the coding. Okay, then that's the final question, and I'll let Isabel take over again. How do you code news coverage of conspiracies or news coverage of politicians making claims that could be justified as junk, like Trump saying it was similar to the flu? Thank you, Julia. That's a really great question. So for the latter, news coverage of politicians making dubious claims, we coded those based on, again, the content that was being relayed. So if the claim that was being made by Donald Trump was factually inaccurate and in a way that was, for us, demonstrable. And again, there weren't that many of those. You'd be surprised, but a lot of the press conferences that were in the sample, a couple of them were of Donald Trump, defending himself for using the term, the Chinese virus. So that ended up essentially being treated as drunken conspiratorial because it's, bid on the xenophobic and directly went against WHO guidance. Now for news coverage of conspiracies, again, so that obviously was a tricky one. And there's certainly a case to be made, I think, for the amplification of problematic content, and that's something that Hubert and I discussed. If a news outlet is reporting on a conspiracy does that amount essentially to making this conspiracy more broadly seen by people, and should that be under junk, classified under junk news? And we decided against it because often with the videos that did not engage in debunking, but that were simply stating what the craziest conspiracies are, and making very, very clear that these were false or inaccurate claims. If it was from a news report, then we classified it as factual and neutral. Okay, I think I'm going to stop here and thank all of you for tuning in and for all the great questions. And yeah, like I said, I hope this is the first of many successful virtual webinars. And yeah, thanks for joining. I hope everyone stays safe and see you soon.